Well, we're joined now by Professor Maggie Rae, who's President of the Faculty of Public Health. And Professor Rae, when you hear the Health Secretary saying, as he did this morning, the combination of mass testing and measures in Liverpool have brought cases down quite remarkably, have you been similarly impressed with what it's achieved?
Well, I think I've been very impressed with the people of Liverpool, the local public health teams and the local authorities in their determination to respond to this pandemic. They've done an extraordinary job. But I think it's fair to say, certainly from the data I saw, that the infection rate in Liverpool was actually coming down before this programme started. So I think they were already using measures that were beginning to be effective in Liverpool.
So, I mean, they might have worked side by side, but I guess all this year we've heard how essential mass testing is. And now we're finally up and running. That presumably is the right track to be on for this next 6 months or so, isn't it?
Well, I think that those of us in public health, and as you've heard from Solace, the local authority chief executives, and many of my own colleagues in public health, we would prefer a much more targeted testing programme. So I think it's quite right that the local authorities and public health teams have pushed back. We were told that Liverpool was a pilot, and we were going to give Liverpool the chance to work through this testing regime. And of course, most universal public health measures, unless they're targeted, actually have a tendency to widen health inequalities. So we really need to see the results from Liverpool before I believe there should be any attempt to roll out such a model. As I say, I commend what Liverpool have done. They've worked extremely hard. But we do want a better system, and we think the better system would be a very purposeful, targeted at the right populations. We've talked about people that have, we know where there's hotspots, and that would be more cost effective and more effective for local public health teams and councils to use.
But isn't the whole point that it's not targeted, that you actually try and find the places where people didn't expect to find it, because that's how you work out the levels in any one community or city or area?
Well, I think it's much better if you're looking for asymptomatic people, it's much better to find them where you know there's infection already. I think that's definitely a more effective strategy. But I think we really need to make sure that we're not just concentrating on one particular response to this pandemic now, especially given the news we've had today about the Oxford vaccine. And I very much do not want local areas to be distracted by trying out innovative, different schemes on testing that may not be cost effective, may not work, when in actual fact we should be concentrating on the delivery and the rollout of the vaccine, which I believe will be much more effective and really the game changer in dealing with the pandemic.